following is a presentation of Comcast NewsMakers, the program where you hear from the leaders important to you.
Thanks for joining us. I'm Vince Robinson. Joining me in studio is Dr. Jeffrey Cly. He is with Northeast OBGYN Parkview Physicians Group. We want to talk about changes in OBGYN care over the last few years, and there have been some significant ones. Let's talk first about just treatment and education, awareness. What have we seen in terms of changes there?
The big changes in the awareness, especially with the technology of the internet, it's helped us with the prevention part of care, which is one of the better parts. If we can prevent problems before they happen, and if we can't prevent it before it happens, it's helped patients come in sooner so that we can treat things before it becomes a very big issue.
Now let's talk a little bit about technology. We talked about technology in terms of the information side, patients getting more information, but the technology that doctors and surgeons are using now. One of the amazing pieces of equipment is the Vinci robotic minimally invasive surgery. Talk a little bit as we look at the video. What is this machine doing?
It's revolutionizing women's health care. So I would be on the left operating, and it's reproducing my exact movements inside the patient at a 2 millimeter to 5 millimeter level. And the suture is smaller than human hair, and those are 2 millimeter tips. So we're able to do the major surgery on a small level. Patients go home the same day, small incisions. They're able to drive the next day back to normal in 1 to 2 weeks instead of 6 weeks. It's very little pain. It's fantastic.
That's incredible. What other type of technology of this type might we see in the next couple of years?
Well, right now they're working on expanding it so that more and more hospitals have it. They're also working on autonomous little robots that we would drop inside the patient and control from outside, just like Star Trek. And they're also working with genetic therapies, microscopic nanotechnology, so that we can prevent and cure things that are not curable right now.
Why is it so important in terms of this idea of being less invasive? That's certainly a trend that we're seeing. Why is that so important?
Well, it helps the patient decrease the risk of infection, bleeding, and then other problems that would happen, because the more invasive you are, the more body systems you have to interrupt, and the more challenges that a patient could encounter, and it gets a patient back to their life faster.
Now, another change that we've seen, this has to do with the patient-centered care model. Very significant change in terms of approach. What does that mean?
Well, we've been fortunate to join with the Parkview Physicians Group, and we have over 100 doctors from almost all specialties, and we work as a team now. So I'm able to have all the records that a patient's other doctors have, and we can collaborate with their doctors instantaneously instead of from one office to the next office and not knowing what's going on in the other office. So the patient care is so much, the level is elevated. We're striving for excellence, and we're comparing ourselves with Cleveland Clinic, Mayo Clinic, Johns Hopkins, and we're offering that type of medicine to the Fort Wayne patients because of this system collaborative approach with Parkview.
And what is the hope in terms of the positive impact on outcomes with this approach?
That patients would have less complications, they would actually have less need to go to the hospital, and we'd be able to maximize their life, minimize the medical interruption, minimize all the multiple medications and the side effects they would have, so patients can feel normal for longer.
And then what will this mean in terms of doctors and their ability to do their best?
It's great for us because we feel connected with each other, and we can coordinate the care with each other and not duplicate care and minimize the number of tests or appointments patients have. So it just lets us have a much better environment, the type of environment we went to medical school for, to help the patient.
Dr. Clyde, great information. Thanks very much for your time.
Thank you.
That's all the time we have for this edition of Comcast Newsmakers. I'm Vince Robinson. Thanks for watching. We'll see you next time.
The preceding was a presentation of Comcast NewsMakers. Now back to CNN Headline News.